Welcome back to the Global Woman TV show, and I'm back in the office. While long ago, since before Christmas, when I had my last guest, and today I have invited Dr. Atena Shirafkan. She's an expert in facial aesthetics, and now is just the perfect timing to talk about it, Dr. Atena, because the spring is coming. We have spent quite a long time indoors, being in our pajama, but at the same time having a jacket and making sure our face looks great, because on Zoom this is all we want. We want to look confident, we want to look presentable, and that's why I thought having you in this spring show would be the best gift that we could give to some of the professional women who will be watching this show. So tell us a little bit about you first. What drove you to what you do today, and why you're so passionate about helping women to feel great and confident with their presence?
Yes, so I've been doing this particular work for the past 8 years, maybe I think it's 9 years, and it's just grown as much as the patients have wanted it to grow. Patients want a very natural aesthetic. They care about what they look like professionally, personally. They want to look their best, but they also want to look natural too. And so I'm happy to provide that as a service for my patients.
So tell us, when your patients come first, what do they know what they want, what they're looking for, and how do you help them to understand themselves, and also how do you manage to understand them exactly what they want so you make them happy? Because sometimes it looks like what we're looking for is not exactly the real reasons, and there are some other causes sometimes: low self-esteem, low confidence. So do you see this into the holistic approach, or where do you start?
Well, we start with a consultation, which is actually the longest part of the appointment. So it's good to know what the patients expect, what they've had before, what they want the outcome to be, and just kind of see if it's realistic as well, because sometimes it is not always realistic.
And do you have these cases where a beautiful, stunning woman shows up in your office and say, wow, she has everything, why does she need my help? Have you had this experience as well? Because sometimes it happens.
Yeah, I mean, there are very beautiful women who do come in, and then they come in for anti-aging, because they're concerned about the sagging or the lines and the wrinkles, and they do care about that, and they care to maintain it. So there are a lot of people who want to maintain it rather than kind of change their appearance.
This is what I like, is about preventing rather than intervening. So sometimes women just start having that wake-up call when it's a little bit too late. So we get busy with children, so much going on, taking care of everybody in the family, everybody in the world. And then we wake up one day, we look ourselves in front of the mirror and say, I am 50 and I'm not happy. But if we prevent this, probably it goes more natural. What would be your advice? When is the best age to start looking after our face, ourselves, in terms of appearance, so we don't have that crisis?
Yes, I would say definitely 30s onwards. But people age very differently. There are some people even younger than that who have very deep lines and wrinkles, and there are some people much older than that who can even wait until their 40s. So it depends. It depends on your genetics, whether you smoke, your nutrition, how much you go into the sun, how the quality of your skin. So it depends on a lot of things. So we take that into account holistically, like you said.
So what is the best approach that you use? Let's suppose some women are watching this right now, which I believe they will. And let's suppose there are women who are busy with their business, with their career, but they still want to have that balance. They want to look great. What are some of the services that you provide, and some some ideas that you can give them also to use from home, or if they are looking something more, where do they start?
Okay, so at home it just starts with using a good SPF and not going into the sun too much, making sure to prevent, prevention I think is always better than cure. Smoking, try to quit smoking, that's definitely a big one. It really ages people as well and reduces the quality of the skin. And then good nutrition, keeping well hydrated, eating well, sleeping enough hours, and so there's plenty that you can do at home. And then for the lines and the wrinkles that come along, you can do anti-wrinkle injections. You can have Profilo, which is good for tightening the skin as
Tell
time
us a
goes
little bit
on.
more about these two, anti-wrinkle injections and Profilo. What is that about?
Well, we have the Botox, which has been around for many, many years, and that's basically about preventing the lines from becoming deeper, sometimes in the forehead and the crow's feet. And a lot of patients say they feel refreshed. They feel like maybe they've slept well, and their relatives say how well they look. And it's not really about changing their appearance, it's more about being the best for themselves. And they care a lot, even when nobody notices sometimes. They're so happy with the results that they have.
So you're saying that sometimes we can get some help from the outside. So of course the internal work is the most important one. When you sleep well, you eat well, you do some exercises as well. So you try to make that work in your side, but if you get some extra help from a doctor, it's even better.
Yeah, I mean, especially in this day and age, it's become so much more available, so much more affordable. And I think maybe in the past there was a bit of a stigma about it, which is now pretty much almost gone, which is great, because I think, because also a lot of men and women seek these out, and they definitely benefit from it, and they come back.
That's true. Stigma has been around for quite a long time. Women were not talking openly about it, but hey, it's action of care and love about yourself. Whatever it takes to make yourself feel good, why not? So do you think then this also helps in having more confidence and self-esteem, and also make sure that you have that holistic approach? And when you do, let's say, what is the most popular of the intervention that you do, and how does that impact a woman's life?
Probably the most popular would be the fillers and the Botox, which some people use for anti-aging and some people use to kind of enhance what they already have. So yeah, those are the most popular. And then we have the PRP, which is a very natural way to produce more collagen in the skin naturally, so your appearance doesn't change at all, just everything becomes very refreshed.
Can you tell us a little bit more about this?
Yes.
How does it work?
How does it work? Well, we take about 20 mils of your blood, separate the plasma, and activate it and re-inject it into the face, the neck, the hands, any scars that the patient may have, and then the body itself produces collagen and starts to heal. And so patients can come back in for repeated treatments. It also helps lower the acne scarring as well.
And how long does it last?
The results can last up to a year, if not longer. Yeah.
Okay, that's interesting. So apart from that, what as an expert, how many years have you been working with this?
I think about 8 or 9 years, yeah.
Okay, so based on your experience, probably somebody who is listening to you is saying, which one do I choose, this, or this? Let's suppose somebody that hasn't started yet on experiencing this treatment, where they should start.
They should start with, well, I think in this day and age everybody can go online and have a look. So usually people already have an idea in mind of what they want. So they might have, a line in between their eyebrows that they've noticed, and it's starting to bother them. And they go online, they have a look, and then people are very well informed now, especially because you can be. All you have to do is, go online and have a look. But when they come in, we do a consultation. I give them the mirror. I ask them what they think and what they want, and we kind of go from there. So, like I said, some people want enhancements, some people want anti-aging, some people are concerned with scars and sagging, and so it kind of goes off of what I say to them is usually what they tell me. So if they say, this bothers me, but this doesn't, then we work on the thing that bothers them. Instead of the
So
thing
you
that
tailor everything based on their needs and who they are. It's not something that, you just say, this is what you need to do. Is based on listening to their voice and to their needs, yeah?
Yes, absolutely. I think because I think there's a balance to be had as well. I don't think patients want to do a lot of things. It's become very natural and kind of a little bit here and a little bit there, and it's a lot of the time it's for themselves more than anything.
And tell me an example. Let's say when you see somebody smile and happy, or comes with some rewarding, and they come and say, oh wow, I feel great, and they come and say thank you. So how does that make you feel?
I feel great. I feel great that I can make someone so happy, and it fills me with joy, and it gives me a lot of job satisfaction to know that they're leaving with a smile on their face, and they come back and they say I'm so happy. They say it to me, so I know that they are.
Well, I'm so glad that I invited you, because to be honest, I was in that category of stigma as well for quite a long time. I just used to say, the world should accept me as I am. But I was lucky working with the right coaches, and I realized that working internally, it's not enough. You have to work in all levels of your life. So now when I work with women, of course I start from internal work, the mindset, the spirituality, the mindfulness, discovering who they are. But then as you discover who they are and what you want, then you realize that you want to look younger, you want to look fresher, you want to look better, you want to look beautiful, because it's part of the package. So it's not enough just saying, oh, I do yoga, I do meditation, I do this and I do that. That's great, you do that. But also, if you don't get the results, you need to do whatever it takes. And there are cases where sometimes, in a very nice, careful way, when I see a woman, I say, darling, we have been working so much together now. Is it okay if I give you a few more push in some other areas of work that you can do? And say, okay, so how about you go and do your hair?
Oh, yeah.
Nicely.
Yes.
And I said, okay, what do I do with my hair? Well, you can cut it a little bit. I said, what is the last time you colored your hair? And they say, oh, I never colored my hair. I said, how about you color your hair? And in a very careful way, because I said, if you color your hair and you do this and you do that, and also you go and do your nails, and probably you go and treat your face, and just go and whatever, you just do something for yourself. It's like a love for yourself. And I've seen the change that happens, because sometimes it's not just, as I said, it's just about having a degree and all this kind of investment that you do for yourself. But then you feel so confident. You put your high heels, you put your lipstick, your face looks fresh and great, your hair is down, and you have the world in your hands. So that's why I thought the time has arrived where we don't feel ashamed to have it all. And we can have it all. Is that okay?
Of course, it should be okay. Women should, and they should aspire to have what they want. There's nothing wrong with being ambitious.
Absolutely.
There's nothing wrong with having goals and aiming high and wanting the best for yourself. You have one life, and you have to live it to the fullest. You can't be afraid of the stigma or this or that. At the end of the day, you know, if you're going forward and you're confident, you can achieve and accomplish so many things. And just believe in yourself.
And that's the best way to end this.
Yeah.
Just believe in yourself. And if somebody wants to find you, where do they find you? Do you have an email address or website or
Yes.
address, wherever? Because I believe you may help some women who are still in this journey.
Yeah, so my website is my name, so it's
Put it down.
www.dratena.com.
Excellent. So if you want to learn more about how can you discover the best version of yourself in all areas of your life, and you want to work with Dr. Atena, click at the website that we put it down and you'll be happy. So see you to the next show.